Hello, everyone, and welcome back to the blog. Since the provincial COVID-19 immunization program began in December, we have been following a phased immunization approach aligned with anticipated vaccine supply. And as we have seen in the past, we have to be ready to adapt our approach in case the vaccine supply changes. We saw this earlier this year when we had to rebook second dose appointments to a vaccine shortage. However, it's just as important to be prepared to manage unexpected large surges of vaccines coming into Alberta and be able to administer immunizations as quickly as possible. Thankfully, we've been developing a contingency plan that would be activated at the direction of Alberta Health should we see a vaccine surge. This plan revolves around the mobilization of rapid flow-through clinics. So joining us to tell us more about these clinics and in what situations we'd activate them in, Dr. Cherie Nyssen-Jordan, co-lead for AHS COVID-19 Task Force, and Debbie Goulard, Rapid Flow-Through Clinic Coordinator. So Cherie, I'm going to start with you. Can you expand on why and when you think we need to activate these rapid flow-through clinics?
So we started thinking about how we might be able to deliver large volumes of vaccine, even though we weren't receiving those that supply at the time. But we understand that despite AHS being able to provide about 140,000 doses per week, and the pharmacies being able to deliver about 183,000 doses per week, and possibly some additional work with the physician clinics who are anticipated to deliver about 50,000 doses. We know that there's probably going to be times when we have a big drop of vaccine supply in the province. So despite being able to deliver about a total of 350 to 400,000, we wanted to be prepared if we were to get about 500,000 doses in the province. So that was where the concept of a rapid flow throughput mechanism would be in place. And the discussion with the GOA Task Force and Alberta Health then defined the rapid flow clinics, which we've now moved forward to plan and prepare for.
So Deb, next questions for you. What model would we be using for these clinics and where would they potentially be located?
So the model we're using for the clinic varies based on where they're located. So we are going to locate them in the major urban regional areas. So Medicine Hat, Lethbridge, Red Deer, Calgary, Edmonton, Grand Prairie, and Fort McMurray. 6 out of the 7 clinics are going to be running and they'll just be an expansion. So they're currently running as immunization clinics and we will expand them. And for example, in Lethbridge, if we have 20 stations, we may expand by increasing the hours to 16 hours a day or by doubling the number of tables that are vaccination tables or vaccinators that are available to make it 40 a day to allow them to give 9,000 doses a week, which would be double what they're giving now. In Edmonton, we are doing a different model where we're doing what I would call a pop-up clinic. So when we're asked to initiate the clinics with 7 days notice, the Edmonton zone will move into the Expo Center and pop up a clinic for the time to be able to give their allotted 50,000 doses for that week.
Great, thanks, Deb. So I'm going to follow up, Deb, with 2 other questions. What kind of preparations are in place if we need to move forward? And obviously mobilizing these clinics are going to be a big job. So who else are we going to involve in terms of helping us with this?
So the preparations to move forward, number one, we've been identifying the sites, and in some of the areas, we are just in the process of moving into those sites and hope to be ready to go by April 5th. So as we identify the sites and moving in, for some of the areas like Lethbridge and Medicine Hat, they're already in the sites, but they're making sure they have the ability to ramp up quickly with hours. Of course, with any mass immunization, our biggest challenge is staffing. And so we're in the process of reaching out to all our non-unionized employees to understand if there's any availability from those employees to give us 2 days a week, 1 weekend, to help us when we have to bring these clinics up quickly on 7 days notice. And part of that preparation is to make sure they're trained in the vaccination modules and have the ability to assist us with the immunizations. The other part of this is getting ready with equipment. Obviously, we need vaccination fridges, we need tables, we need chairs, we need signage, we need security. And so we continue to work on making sure all of that's in place as we get ready for a 7-day notice. In an endeavor this big, we need to have all kinds of partners to assist us. So right now we've been working very closely with the government of Alberta and the municipalities to help us to identify sites, to help us with the leases, to help us with security, to help us with facility maintenance, and to help us with parking or any of the other sundries that are involved in bringing a site up and running. We have had lots of physicians who have volunteered and dentists to come forward and help with the vaccinations for these rapid flow through clinics with 7 days notice.
Wonderful. And final question goes to you, Cherie. Do you anticipate any challenges if we do need to activate these clinics?
There are lots of challenges. Probably the biggest challenge is notice and when we're going to find out when there is going to be a sufficient vaccine supply. We've been finding out sometimes as short as 2 days beforehand whether or not we're getting vaccine supply. So that is our biggest challenge. The second thing is, obviously, if we're not using these and we prepare for them and we have the staff in place for them, then there may be some of this staff that is not doing a whole lot and so get bored waiting for it. So we need to have some way to kind of keep them busy. At the same time, we have to continue to offer the 140,000 doses that AHS is responsible for the rest of the time. So all of those are very big challenges that we're going to have to face in trying to maintain the preparation for this. And not to mention the budget costs and certainly public expectation. We are finding that there is a lot of public out there that are looking for these rapid flow sites. And frankly, we are able to deliver the services in our current sites without the need for using a rapid flow site. So we're trying to kind of balance the needs with what's most appropriate with the vaccine supply that we've got.
So really thanks to both of you for coming on today. And I just want to say thank you to you both for your incredible leadership during this vaccine rollout journey. And Debbie, I know you've tried to retire a few times, but every time you try, we bring you back. Well, that's just a testament to obviously your leadership and your skills. Vaccination is the most important topic for us right now because it is a race against the rise in the variants. So it is so critical for us to vaccinate as many Albertans as we can. And as you know, phase 2A of the COVID-19 immunization program began on March 15th. This group includes Albertans born in 1956 or earlier, and First Nations, Métis, and Inuit people born in 1971 or earlier. I encourage all healthcare workers who are eligible in phase 2A due to age or other eligibility criteria to get their vaccine as soon as possible. We're very hopeful that if vaccine supply comes and increases in the next month or two, that we can move very quickly into the next phases. We will continue to target the month of June to complete all first doses for all Albertans who wish to have the vaccine. So thank you so much for your enthusiasm to get immunized and for your patience as we continue the rollout. I know it's really difficult to wait, but we are immunizing as many people as we can, as quickly as we can, based on current vaccine supply. And if you were to ask me last year that we could potentially immunize within AHS 280,000 Albertans a week, I would have probably laughed. But you know, it is really kudos to our incredible teams and all the planning, the implementation, understanding all the logistics really has led us to this day. So until next time, thank you so much for your continued dedication to protecting the health of our patients and each other. Take care, stay safe, get immunized, and we'll see you next week.
Together, we do amazing things every day.